Hi, I'm John Parks, and I want to talk to you today about something that's kind of an embarrassing subject for men, and it's something that I came down with about 3.5 years ago, and that's called Peyronie's disease. Peyronie's disease is where a plaque develops in your penis, and then when you get an erection, it causes your penis to bend. And it bends to the point where, in my case, almost a 90-degree angle, and it was completely unusable. I was on a vacation with my family on Kauai, and here we had a beautiful 2-bedroom condo on the water, and it's supposed to be a big romantic vacation on the garden aisle. Just a great time, and something started happening to my penis. And so when I would try to be intimate with my wife, it was getting more and more uncomfortable. I was having painful erections, and what was supposed to be a romantic, wonderful time together turned into a nightmare for me and for her. It was painful for her, it was painful for me. So upon returning back home, I went straight to my doctor and had him check me out, and I took a picture. I got an erection, took a picture of it, because I sure didn't want to have to go to the doctor and have them mess with that. And I would suggest any of you that go to the doctor to do that. And he looked at the picture and he said, yes, he goes, you have Peyronie's disease, and I didn't know what that was until then. And he said, I'm going to send you to a urologist. So I went to a urologist, and he examined me, and he said I had a large plaque, and that he was going to suggest I use vitamin E oil, take vitamin E orally, and then he prescribed verapamil for me, and then I also did a series of injections over a 6-month period of time. At the end of the 6 months, my penis was getting worse, if anything. It was not improving at all, and he said, well, as soon as it stabilized, he was suggesting that we do a surgery on it. And the surgery consists of cutting a wedge out of the opposite side from the plaque, and it would straighten the penis. The penis would be shortened about 1/2 of an inch or more, which I felt was really not an option. I don't think anybody would be very pleased about that. And he described the surgery as it would improve the straightness, but I might lose some feeling. He said it was kind of the best of all alternatives. And he made kind of a joke about practicing medicine really was practicing, because they didn't really know a lot about this. And he described the structure of the penis. The inside of your circuit has interwoven material, and it's unlike any other tissue in your body. And he goes, and this interwoven matrix starts to fill with little bits of collagen, and it builds up a plaque, and it causes a blockage. It hardens, and it becomes, the blood can't go past it, so then the blood will go into the penis, it hits that plaque, and it bends around it. So it's very uncomfortable, it's painful, and you're sure not going to make your partner happy, and much less yourself. So I felt that surgery was just really not an option for me, and I had to explore other options. And so that's what this website is all about. I found a cure. I now am back to where I was before. It's nice and straight. I'm having firm erections. My wife and I are having just a great time together, and it's just working out. It's worked out great for me, and I want to share what worked for me, and hopefully it'll work for you if you're in this situation. You know, the economy right now, it's a scary time, and you watch the news and you get scared. But when your penis takes a 90-degree bend, that's the end of the world. That's just the end of everything. And that's how I felt. I was despondent. I felt like life was over for me. I was so upset. I didn't feel like I was a man anymore. And I'm doing this because I want to help you guys, and I don't want. It's a hard thing. It's hard for a lot of men to even go to the doctor and talk about this. So I'm willing to talk about it, and I want to let you know what you can do about it. And hopefully this website will help you go through there. There's links to all of the different things that I used. This is not a program where you purchase something for $1,500 or $1,000. It's nothing like that. And I spent over $1,000 just on verapamil, and then I figured out how to do these other things, and it was a fraction of that cost to do my whole program, and I was cured. So I hope you'll go through this, heed my advice, and look forward to a cure. And it's not an overnight cure by any means, and it does take time, and you have to be diligent, and you have to work steadily, and you'll see progress. Sometimes I didn't see progress for probably about 9 weeks before I started to see progress, and it took about a year for it to completely go away. And so I hope this will work for you, and I hope that you'll be patient and you'll work it through. Thank you.